Good afternoon, Baston Jones. Let's begin the warm-up session. What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. Please start your OET speaking role play.
Good morning, my name is Baston Johns, one of the nurses here in the clinic. How may I help you today?
Good morning, Nurse Jones. It's about my daughter, Emily. She's had a fever for the past 4 days, and I'm really worried. It doesn't seem to be going away, and I don't know what else to do.
I completely understand your concern, and it's natural to feel worried when your child is unwell. You've done the right thing by coming in today so we can discuss this together. Well, how may I address you?
You can call me Mihiraa.
I completely understand your concern, and it's natural to feel worried when your child is unwell. You've done the right thing by coming in today so we can discuss this together. Well, how may I address you?
Mihiraa, let's start by gathering some details about Emily's fever to understand her condition better. Could you please explain her condition in detail?
Well, it started at around 100.4 degrees Fahrenheit on the first day, and by the second day, it went up to 102 degrees Fahrenheit. Despite trying some natural remedies, they don't seem to be working. This morning, her temperature was around 101 degrees Fahrenheit.
Thank you for sharing that. It's helpful to know that you've been monitoring her temperature closely and giving her medication to manage it. Apart from the fever, has Emily been experiencing any other symptoms?
Yes, she's had a bit of a cough and a runny nose. She also says she feels tired all the time. Yesterday, she complained that her throat was hurting. But she hasn't had any vomiting or diarrhea.
I see. Now, I'd like to know more about her medical history.
Yes, she had pneumonia last year, which is why I'm worried. But she's up to date on her vaccinations, including her flu shot. She isn't on any medication other than what I've been giving her for the fever.
Thank you for that information, Mihiraa. It's reassuring to know that her vaccination status helps protect her from severe infections. Now, let's focus on what you can do at home to help Emily recover. Keeping her hydrated is crucial, so continue offering her fluids like water, clear broths, or electrolyte solutions. You can also give her acetaminophen or ibuprofen to manage the fever, following the recommended dosage based on her age and weight. Ensure she gets plenty of rest, and if she's feeling restless, engaging her in quiet activities like reading or drawing can help. Monitoring her symptoms and providing comfort will aid in her recovery. If you have any concerns, don't hesitate to reach out.
Yes, I've been trying to get her to rest, but she gets restless sometimes. I'll make sure she drinks more fluids. Does she require a doctor's consultation?
That's great to hear. Now, I want to make sure you know when to seek medical attention. If Emily has a fever lasting more than 5 days, a high fever that doesn't respond to medication, or shows signs of dehydration such as dry mouth, no tears when crying, or reduced urine output, it's crucial to consult a doctor. Additionally, if your child appears unusually lethargic or has difficulty breathing, please seek immediate medical help. Your child's health and well-being are our top priority, and we're here to support you through this. If you have any concerns or questions, don't hesitate to reach out. Like reduced urination or dry lips, please seek medical help immediately. Mihiraa, do you have any other concerns?
Yes, I've been trying to get her to rest, but she gets restless sometimes. I'll make sure she drinks more fluids. Does she require a doctor's consultation?
It's completely understandable that you're concerned. Mihiraa, fever in children is actually very common, and most of the time, it's caused by viral infections that just need time to run their course. Think of it like the body's way of fighting off the little bugs that are making them feel unwell. Sometimes, even things like teething can cause a slight rise in temperature. We also know how worrying it can be when your little one is unwell. That's why it's so important to keep a close eye on them and know when to seek medical advice. Seeking medical attention is essential for identifying underlying conditions, ensuring effective treatment, and preventing complications. Ignoring symptoms can delay diagnosis, making recovery more difficult. Early intervention improves outcomes and reduces health risks.
Sure, nurse. I got it. Thank you for your help.
You're very welcome. I wish Emily a speedy recovery.